Welcome to StartUpHealth TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster, with my guest, Brant Herman, CEO and founder of MouthWatch. Great to see you, Brant.
Thanks, same here.
It has been really cool to watch your journey and sort of see how you're making teledentistry a reality in the world. You've had various other products, but you've come out with this thing, DentistryOne, which is really exciting. So I want to start there. Tell me all about it.
Yeah, DentistryOne is a virtual-first oral healthcare network. So we have a national network of over 400 dentists who can provide a virtual consultation to a patient no matter where they are, smartphone, laptop, tablet, wherever they need to be. So we're really addressing access to care challenges, which is tied to our moonshot, but transforming how patients come into the dental care journey. And we added not only the dental consultation, but we do care coordination, so that following your virtual consult, we're connecting you with real care. We want to make sure, unlike telemedicine, it might be a prescription and your issue is gone. We need to make sure patients are getting in for preventive care, hopefully emphasizing that, and then really connecting them, helping them understand their dental benefits, and with a bigger emphasis, which we can talk about a little bit, on systemic health, and showing how your oral health really improves outcomes, improves your experience as a patient when you have some chronic disease conditions.
So what kind of dentistry issues can you handle through a teledentistry platform? Because, not specializing in that area myself, it feels like an area where I need to go and have somebody stick their hand in my mouth, right?
Yeah.
So what kind of things can you do remotely?
There's a ton. So you can really help patients understand the need for treatment. If it's an emergency, that's an obvious case that we can help them reduce inflammation, route them to a practice for treatment. We can also help them understand cosmetic consultations, clear aligner treatments if that's an option, home care routines that can really improve, systemic health education. So as a diabetic patient, what can you do at home to improve and reduce inflammation? And then bridge that gap and help facilitate home care. We're also excited about some ideas where we can do fulfillment direct to a patient of preventive care products. So we can support remineralization, fluoride varnishes, things that build tooth structure back and protect tooth structure so they don't have to come in. So you've got kids on Medicaid with CHIP. If you could educate their mom about nutrition, guidance, and then actually deliver some home treatment to them for prevention and protection, that's a lot that we can do.
At a really practical level, we're talking about using a smartphone camera and looking in the mouth just with whatever you've got available, or how are we delivering that sort of guidance?
Yeah, right now it's really through the webcam or through your smartphone camera. And in that case, it's more guided instruction and collaboration with the patient. So simple cheek retraction. We've looked at ways to get a device similar to our camera, but at a much lower price point. We're still pursuing that, but we've seen so much ability to really understand the patient need, treat them effectively, and like I said, route them into care where needed.
It sounds like there's a lot of low-hanging fruit. If you can just look at somebody, have a conversation, pull back the cheek, there's like a lot of good that you can do.
Yeah, and we really see ourselves in that role of, I hate to say easy button, but facilitating a much easier patient journey where if you are suffering some systemic disease or a chronic condition, or let's say you're pregnant, revealing those outcomes and improvements to your baby's health, your maternal health, cancer treatment and chemotherapy, the burden falls on the patient to guide themselves into dental. It's not part of the general healthcare system, even though it's an essential part of the healthcare system. So what we're trying to do is say to that oncologist, scan a QR code, get this patient connected to a DentistryOne dentist, they'll understand the need, and then we'll take care of almost the concierge service of booking an appointment with your existing dentist or routing you to a new dental home if you need one.
Where is the macro conversation right now around recognizing the link between dentistry care and whole health? It's something that you've talked about for a while and that we know to be true, and yet there's still elements of healthcare that have been slow to understand or adopt.
Yeah, systemic health faces a systemic challenge in healthcare. So I think there's more appreciation and recognition. This research is proven. We're not doubting that anymore. I think it's the application of it. What we love with DentistryOne is using technology to be the digital bridge between siloed medical and dental. So unless it's a fully integrated model, which is rare, how do you connect that medical setting to understand that this patient now has this disease. It's one of over 60 that have a correlation to improved oral health outcomes, improving the systemic health outcome. How do you bridge that? Yeah. You can train providers all you want on the medical side. If it ends up with the patient having to do it, it's still going to drop off. So that's where we have an integration with Epic and other EHRs, where we're planning to then send a trigger notification to the patient that after we see a diagnostic code, now we know you're going to improve your outcome, so let's route you into a dental consult and then get you connected to care.
What has the market reaction been like? What's your traction been like with Dentistry.One?
Yeah, so we've signed some contracts, typically on a Medicaid plan, where we're really boosting engagement and interaction focused on prevention. I think the adoption in the marketplace is, it's about time. And there was no way to really accomplish this with just traditional practice models and siloed healthcare systems. So I think finding payers and also going to employers where we can look at an employer base and say, look, we can striate your risk of diabetic patients, cardiovascular disease patients, where you're spending more of your own funds covering their claim. Let's engage them more in their dental care, so you're going to see those outcomes and cost savings and happier, healthier employees.
Yeah, and just going back to that accessibility piece too, I'm curious sort of how long it takes to get care. I mean, it could be 8 to 12 months for me to get in to see a dentist. It's really wild. So like, how are you thinking through accessibility?
So on the private practice side, even with the best commercial plan, the average wait is still 25 days, around there. On Medicaid, it's even worse. There's so many provider shortage areas in this country. That's why I love. So click a link and I'm in an actual consultation. Now I can address my need. How important of an emergency is it? Can I take some medication at home? Will inflammation with an antibiotic be, helpful for letting me wait? Also, I think just getting that understanding for the patient to know, we've seen in studies with our TeleDent platform, 3 out of 10 emergency teledentistry consults don't require a visit.
Yeah.
So now we want to free capacity up for practices, make them more efficient, and really route a more educated, informed patient into those practices.
I'm guessing dentistry practices appreciate that, seeing the right patient at the right time. What kind of feedback are you getting from them?
Yeah, they love a new referral source, and I think an educated patient is a much more willing patient.
Yeah.
They're not going in with that fear that I think we've all had, and I'm the son of 2 dentists, where it's an unknown.
Yeah.
I don't know if my cleaning is going to lead to something more significant, or if I have this unknown that might be pain-based, what it might be. We also love that we reduce anxiety. There is no drill, there is no needle. You are just in the comfort of your home, having a candid, no judgment conversation about your oral health and any dental needs. Get that education so you can go into a practice and get what you need.
Instead of sitting around for 21 days or whatever with tooth pain,
right,
anxious about what this could be for your future.
Yeah, and I think that broader goal is really focusing on prevention. So we're lowering the total cost of those emergencies by making it more convenient. Only 40% of Americans see the dentist every year. So we want to make it as easy as possible to move that number up, focus on prevention, keep them healthier.
Love it. Brant, I appreciate you coming by for an update. This is exciting to see this development with Dentistry.One. I'm a firm believer that we need to move forward in this connection between dentistry and whole health, and you're leading the charge, so I appreciate that.
Thanks so much.
All right, thanks, Brant.
All right, appreciate it.
Be well.